Working with diverse families in healthcare. When working with diverse families in healthcare, one of the first steps that we must take is to understand and define cultural competency and how we can provide culturally competent spaces, programs, and services for the families that we serve. We must understand the different definitions, cultural versus linguistic competency. So cultural competence is a set of behaviors, attitudes, and policies that come together in a system, an agency, among professionals that enable that system or that agency and those professionals to work effectively in cross-cultural situations. Linguistic competency, on the other hand, is the capacity of an organization and its personnel to communicate effectively and convey information in a manner that is easily understood by diverse audiences. That includes people with limited English proficiency, those with low literacy skills, individuals with disabilities, and those that are deaf and hard of hearing. Linguistic competency requires organizational and provider capacity to respond effectively to the health and the mental health literacy needs of the populations and families that you serve. It is also important to understand cultural humility versus cultural competence. What then is cultural humility versus cultural competency? Cultural humility is the ability to maintain an interpersonal stance that is other-oriented, basically open to others. It's different from culturally based ideals because it focuses on our self-humility rather than achieving a state of knowledge or awareness of a culture that one does not belong to. We also want to understand the continuum of cultural competence and where we fall on that scale and what steps we can take to continue down the trajectory to provide cultural competence spaces. So as you see on the cultural competence continuum growth chart, you start with cultural distractiveness on one extreme side versus the other side with cultural proficiency and all the steps in between as you see on this diagram. Why then is this work important? It helps to eliminate disparities in healthcare. It provides culturally and linguistically appropriate services to improve patient outcomes, efficiency, and cost effectiveness across the healthcare delivery system. It also improves awareness of implicit bias, and then it fosters an approach of openness that is ongoing, where you explore and reflect on your personal beliefs and behaviors. In healthcare, it's important for us to understand cultural beliefs and values because that then ensures that the results are delivered in a manner that is sensitive and respectful of cultural norms. Disregarding those cultural norms may add stress to an already difficult situation that will cause impacts on mental health, quality of life, and negative health behaviors. So talking about those other important terms that I referenced in the beginning, it's important for us to know about stereotypes, implicit bias, explicit bias, microaggression, and intersectionality. Stereotypes are those snap judgments that we make about a person or a thing that influences our decision making. Every day we get millions and millions of bits of information in our head that we associate good or bad about certain people or groups. It's important for us to learn and identify how those stereotypes can then become racial stereotypes. Racial stereotyping leads to discrimination and dangerous behaviors when left unchecked. So it's important for us to prevent them and in our behaviors, and that will help you to begin your awareness of how that could affect how you react to others. Implicit biases are those thoughts and feelings that are implicit. We're unaware of them, or we're mistaken about their nature. When we have that bias, rather than being neutral, then we'll have a preference or an aversion to a person or a group of people. We use the term implicit bias to describe when we have attitudes towards people or associate those stereotypes with them without our conscious knowledge. It's fairly common. Explicit bias is then deliberately holding that belief about a person or a thing, and usually it's expressed overtly and can become a microaggression, which is a stubborn behavior. It could be verbal or nonverbal. It could be conscious or unconscious, but it is directed at a member of a marginalized group, and usually it has a harmful derogatory effect. What then is intersectionality? Intersectionality is the overlap of those social identities such as race, gender, sexuality, class, that contribute to the systemic oppression and discrimination experienced by an individual. In healthcare, it's important for us to recognize and be aware of intersectionality as it reflects the experiences of most of our marginalized children and families. We need to consider how in healthcare and in medicine, how that intertwines with screening and diagnosis and treatment. We also need to recognize intersectionality to help to respond to inequities in the provision of healthcare services. Understanding the barriers and the burdens that families have might help you to understand why they have issues with follow-up to screening. And it's important for you to learn that so that you can work with them to identify and address those barriers. Other barriers are limits on language access. It could be limits on immigrant eligibility. They could be scared or hesitant to talk to their child's provider, or they could lack, it could be because of the lack of cultural diversity among providers, healthcare providers, which causes mistrust. It could be a lack of awareness of the resources, not being able to access those early resources such as early intervention and other screening resources that are available for most families. And unfortunately, it could be because of intimidation by anti-immigrant rhetoric. Thank you for watching. Join us next time for part 2, where we discuss the role of healthcare providers.